My name is Mackenzie Mullis, and my topic is population aging and nursing. So, I'm going to be speaking on how the change in demographic is and will affect those in the healthcare field as well as those receiving care. A general overview of population aging. As we've talked about over the entirety of the course, the world is aging and is doing so rapidly. A few facts I wanted to point out that I came across in my research are these. The National Institute on Aging claims that in 2006, almost 500 million people worldwide were 65 and older. By 2030, that total is projected to increase to 1 billion. That means that 1 in every 8 of Earth's inhabitants is 65 and over. For the first time in history, those over the age of 65 are projected to outnumber those under the age of 5. Population aging is due to the increase in life expectancy during the 20th century. So this is happening currently, and it's going to keep happening through the upcoming centuries. In the 20th century, nations experienced more than a doubling of average life expectancy. Life expectancy is increasing due to advancements such as enhanced living conditions, preventions of diseases, earlier access to healthcare services, as well as many other factors that support human life. As the world continues to adapt and advance, there is more potential for human survival, allowing us to live longer. So, population aging and its effect on health. So, living longer does not always equal living healthier. We spoke on the epidemiological transition. This is the shift from the leading causes of death and disease from infectious disease to chronic and degenerative diseases. So, older age comes with decreased mental and physical health. One of the examples that I continually ran into during my research is the disease dementia. It is a degenerative disease that causes a loss of memory, reasoning, speech, and other cognitive functions. About 7% of those who are 65 and older are affected by this disease. It affects older adults and continually gets worse over time. It is hard to diagnose, and especially when it is in its early stages. On top of diseases like that, aging also comes with problems such as frailty, falling, and other conditions that lead to a loss of independence. As we all know, bodily functions decrease over the course of our lives, so even simple things such as not being able to be as strong or independent as one once was causes degeneration in an older adult's health. Effect on the healthcare system and nursing in particular. Increasing age affects the healthcare system as there is a shift in the kinds of diseases and the types of patients prevalently seen by those in the healthcare field. Nurses provide the front line in healthcare for older adults in many settings. There are a lot of medical resources sought out by not only older adults, but there are a lot of things that older adults need to seek out based on their individual situations. So there's preventative care, acute care, long-term care, assisted living, and these are all things that nurses are needed in. Due to the fact that people are living longer, there's an increase in the prevalence of chronic illnesses. Often more than one chronic illness is seen in older adults, and this leads to complex healthcare needs. Not every person is able to successfully be prevented or treated with the same treatment. So healthcare workers have to individualize prevention and treatment and care based on the individual's needs. The elderly and ill require more assistance at home to accomplish everyday tasks. Nurses can provide older adults with ways to maintain independence, function, and health. They can also give patients and their families tips on how to care for themselves and their loved ones at home. in order to maintain a certain level of independence. As I said, they provide support for the family as well as the patient. Speaking back on dementia, um, that is a disease that really needs an entire family's support. So the nurses not only provide the patients with care, but they also provide that support for their loved ones and really teach them how to care for those patients. An increase in population age will put stress on nursing homes to expand and accommodate for more patients. There, that is there's positive and negative to this. So one of the positives is there would be an increase in jobs. So there would be more need for nursing staff, construction workers when nursing homes are expanding. But the negative is that since there's more demand for nurses, there is a demand also for higher wages, which then would cost more for services for the patients. And on top of that, since there is more demand for the healthcare providers, there would be a longer wait for basic appointments for patients to be seen. Nursing education. Population aging will bring changes to the education required for nurses in order to assure that they are qualified to work with the elderly. Geriatric education will need to be implemented largely into the education requirement of medical staff. So the nursing education now will have to be able to shift with the shift in the demographic. If they're unable to care for the geriatric patients, then there's not a lot that they can do to prepare for the upcoming centuries and the population aging. Due to the fact that the majority of patients in the upcoming decades will be older adults, those practicing in the medical field must adapt when training in order to make sure that they are passing along the necessary information. Without having the knowledge of those who have been in nursing for up to their entire lives, they have not had to deal much with the population aging, at least not as much as those who are coming into the nursing field now will have to. So as you can imagine, without having that further that knowledge, that wisdom, they aren't able to pass it down to those who are new to the field. That is why the Hartford Geriatric Nursing Initiative and the Building Academic Geriatric Nursing Capacity programs are making efforts to ensure that the next generation of nurses is properly trained to deal with older adults. So they are trying to give those nurses who have been in the nursing field for quite a while, who haven't had to deal with the population aging as much as those who are coming in will have to in the upcoming centuries. They're giving them some of that information that they need to be able to properly care for those patients. So preparation for this shift. Those going into the nursing field may want to focus on specialization in geriatrics or a related field in order to be prepared for the upcoming shift in this demographic. So as I said before, education. Nurses now are going to have to take classes specialized for caring for older patients, since that is going to be the new demographic that they will be focusing on. Shift focus to making clinical and home plans for elderly patients in order to be able to provide proper care. This means better understanding the health risks faced by older adults in order to provide prevention and treatment. And it's also helpful to find ways to detect and diagnose diseases that affect the elderly. Back to the example, dementia, it's important that since we know that we will be caring for an older an older population that we need to be able to diagnose their and prevent their illnesses before they happen, so that we can better care for those patients once they reach a point where they are old enough to develop these chronic diseases. And that is my slideshow. Thanks for watching.